What I've recently done is acquired a sensory processing disorder practice from a retiring optometrist. I've hired one of his employees and bought some equipment from him so we can integrate sensory processing disorder therapy into my optometry practice. So I still see, primary care optometry patients, but then hopefully we can help a lot of patients that have a sensory processing disorder through a therapy program. The number one kind of patient I'll see is a child that's maybe 5 or maybe even 3 to 8 years old, 10 years old, that has a sensory processing disorder in the sense that they can't process the visual information or the auditory information or their tactile information as efficiently as they can. The end result being they're very hyper, they can't sleep, they have a difficulty in school learning. The sensory learning treatment that we do is it uses a moving bed that retrains your brain to go from right to left and left to right. So it rotates you along your midline. You listen to auditory information, and you do that for 12 days while you're looking at different colored light.
I feel like when I'm doing it this way, I feel like I'm rolling down a hill, and when I'm doing it this way, I feel like I'm going backward, doing a backward somersault.
I've seen over the past 7 years amazing results with these children and adults. Anything from kids who have Asperger's, autism, ADD, ADHD, traumatic brain injuries. We just see that the brain reorganizes, and a lot of the symptoms that they come to us with are either lessened or totally eliminated. So it's a life-changing therapy.
Well, if you have a child that's ever had a meltdown at a store, sometimes for whatever reason, and you no longer have those meltdowns, that's a huge step. Or one of the biggest improvements is the child will sleep through the night. Sounds simple, but if you've ever had a child that is up every 2 or 3 hours, it's very reckless on the family. And so they're able to rest and relax and sleep through the whole night. That's a big, big, big improvement.
Affecting the family is huge because when you have a child with sensory issues, it's not just affecting your life or their life, it's affecting everyone around them.
It's based on some occupational therapists, some MDs that worked in the auditory spectrum, and then the research in optometry, and tied that all together. It's been around, it was started approximately 25 years ago where a person started to combine all 3 categories into one treatment plan. And so it started in Colorado, and there's 34 centers around the world that actually partake in this treatment protocol.
It's just yes or no questions to different sensory areas, and then they submit it to our office, and then I get it, and then I call them, and we go over it, and we find out exactly what's going on, what their biggest concern is, and then we set up a time to do a orientation type session where they come in and they actually have the child experience what the program is like. From that point, if they do choose to continue on, then we do a lot of testing. We really want to get some good baseline information on where they're at with their sensory system. And then once we do all that, we start the program.